Hi, namaste everyone. A very good evening. So I hope you guys are ready. So let's restart our quick revision classes and we'll start with anatomy. I've chosen some select topics and I will discuss the same in the form of multiple choice questions. Before that, please confirm the audio and streaming quality. And since we'll be streaming this session via Zoom and YouTube, there will be a delay or lag of 20 seconds. So once you come across any question, uh, it takes at least 20 seconds for me to get your answers because of this lag. So what I'll be doing is after posting the question, I'll be reviewing some important relevant information and I'll make sure that I'm not giving you the answer in the process. And after that, after I go through your answers, I'll be revealing the answers. So that's how we'll proceed with this series of quick revision classes, right? I hope it's fine. And as I mentioned, any feedback is always welcome. So I hope you guys are ready. So let's start as soon as possible. Okay. So before I start, yesterday's live session where we discussed about 15 days before NEET, what should you focus on? I hope the session was helpful. And one particular thing which I wanted to highlight, and if you observe the entire session, one particular point which I was trying to highlight indirectly, which I'll be telling you now directly, is the fact that confidence building measures have to be employed during the final days of preparation is of paramount or the most important thing. So no matter what you do, it can be MCQs practice, it can be attending discussions, it can be revising your previous test papers. No matter what you do, there is no hard and fast rule that you have to do so and so things. But no matter what you do, if you are building up your confidence in the process, then the objective or the purpose will be fulfilled, especially in these final days of preparation. So confidence building measures. So make sure that you're taking up these confidence building measures in the form of MCQs practice, attending revision classes or anything based on your convenience, so that no matter what you do, they should be enhancing your confidence. If it is otherwise, it means it's an indication, clear-cut indication that you need to ditch that particular task, right? So that's something which I wanted to highlight. So let's continue with our quick revision class. And also, we'll have some image-based questions, case-based questions, and that's how our format will be. I hope you guys are all already familiar, right? So this will be our 14th quick revision class. Yeah, so a very good evening, all of you. And also we have our Flyboy. So we nicknamed this guy Flyboy in our garden. So even Flyboy says good evening to all of you. So first, as I said, today's quick revision class will start with anatomy. This will be a 14th quick revision class. So previously we covered some clinical. So we'll start with basics first. So anatomy, first question. So what do you think the answer is? Muscles that help in elevation of mandible are all of the following except. So whenever you face any question, make sure you're going through that, including all the options at least twice. Make it a rule, right? A self-imposed rule. So muscles that help in elevation of mandible are all except. Yeah, Flyboy. Option A, temporalis. Option B, masseter. Option C, lateral pterygoid. Option D, medial pterygoid. So which one do you think is more appropriate answer? So muscles that help in elevation or elevating the mandible, right? That help in elevation of the mandible. I'm sorry, off is missing here. Include all of the following, except. So we have the following options, right? Various major muscles of mastication all mentioned in the given options. So if you observe, these muscles of mastication are those which help in mastication by simulating movements at the level of TMJ, as you guys are already aware of. And there are mainly two groups of muscles. We have principal muscles and then we have accessory muscles. The ones which you can see in the options are principal muscles. And when I say principal, can anyone give me the spelling of principal? The principal which I'm talking about in this particular context, but not the principal in our colleges or schools? Please, can anyone spell principal for me? So we have principal muscles, which include muscles of mastication, which include temporalis, masseter, lateral pterygoid, and medial pterygoid, as mentioned in the options. And then we have accessory group of muscles, which have a role, but not as significant as principal. That's the reason why we're calling them as accessory. And these accessory muscles of mastication include, as you know already, buccinator, digastric, mylohyoid, geniohyoid. So we have these two groups of muscles. So among them, there are several options. So, okay, it's not P-R-I-N-C-P-L-E. No, that's the wrong spelling. That's the reason I've asked you to spell out principal. P-R-I-N-C-I-P-A-L, principal, which means main or major, right? So the principal spelling in this context is P-R-I-N-C-I-P-A-L, just for information. Okay, right. So among the following muscles, I think most of you have answered it as option C, which is the right answer. Good, excellent. Lateral pterygoid. So let's review some muscles of mastication. We'll get back to this slide after this. So you can see, in fact, we discussed the same in one of the paper discussion videos I made. So you can see different types of muscles. Principal muscles, PAL, principal muscles of mastication, their shapes, origin, insertion, nerve supply, and action. And if you observe the action, so temporalis helps in elevation of mandible and retraction. Masseter helps in elevation of mandible. Lateral pterygoid, depression of mandible, which means opening of mouth, isn't it? And medial pterygoid, quadrilateral in shape, elevation of mandible and retraction. So these functions or actions are simulated or represented in this particular illustration along with accessory muscles of mastication, where you can see different directions, right? So you can just observe these images in your free time and get familiarized with these topics, and it will be much more fun. That's how we can master anatomy, especially, right? So as you guys mentioned, muscles that help in elevation of mandible. So these include temporalis, masseter, medial pterygoid, whereas lateral pterygoid helps in depressing the mandible or opening the mouth, as we have seen in these tables, right? I hope it's clear. Well done. Well done. So from next time, I will try to give you more complex options so that you can find it even more tough to answer. Second question, false capsule of thyroid gland is derived from which are the following options? Pre-laryngeal fascia, pre-tracheal fascia, peripheral condensation of connective tissue of gland. This seems to be more appropriate. I mean, that's my pre-answer opinion. Option D, investing layer. So which one do you think is more appropriate answer? So we'll get back to an illustration which depicts various layers or capsules of thyroid. But before that, as you know, we have broadly two types of capsules. So true capsule and false capsule. Yeah, true capsule and false capsule. So true capsule is something which is formed from the material of the gland. That's why we call it as true capsule, isn't it? So true capsule is the peripheral condensation of connective tissue of the gland. Option C. What about false capsule? False capsule is derived from a particular layer of deep cervical fascia, which you'll be answering now. It's thin along the posterior border of lobes, but thick on the inner surface of the gland, where it forms a suspensory ligament of Berry, which is very, very important. And this connects the lobe to cricoid cartilage, right? So as most of you have mentioned, option B, pretracheal, is right answer. Well done. And you can see an illustration depicting various layers or capsules of thyroid. True capsule and false capsule. And also you can see venous plexus, plane of cleavage, and thyroid veins. So false capsule is derived from pretracheal layer of deep cervical fascia, which is thin along the posterior border of lobes and thick on the inner surface of gland, where it forms suspensory ligament of Berry, which connects the lobe to cricoid cartilage, right? Well done. So option B is a right answer. Now let's move on to next question, an image-based question. Let's see how many of you are going to answer it right. So you might be assuming that why this guy is giving us all easy questions. So to all those who think that way, here is a challenging question to you. So observe this illustration, and please don't talk about extension of lashes and the makeup which is seen on the eyelid. Come on. Okay, talk about the wrinkles which you see and which muscle is responsible for this, and what do you call this appearance? No options whatsoever. Just observe these illustrations and explain the illustration in a single phrase or a single word if possible. The challenging question to you. Yeah. I mean, I would love to go through some relevant information, but that would reveal the answer. So this time, for this particular question, I'll wait for 15-20 seconds before I hear out answers from your side, and then we'll review some relevant literature. And if you want a hint, I know it's a challenging question, no options, but if you want a hint, here is a hint for you. You can see an animal here. Let me not name it. You know what animal it is. So observe this animal carefully for a few seconds. I'll move on to the question once again and consider this as a hint, right? Now you can't blame me. Come on, Anashri. Why are you always thinking about apps, smartphones, smart gadgets? Come on. You should come out of that virtual world. Which app do you like the most, by the way? Very good, Shivangi. So Shivangi has mentioned about crow feet. Sujay, well done. Very good. Okay. So obviously this is because of orbicularis oculi action. So let's review some information. Crow's feet. So this appearance is crow's feet, especially seen in older individuals or in zombie movies you might have seen. The contraction of entire orbicularis oculi draws the skin of forehead, temple, cheek towards the lateral angle of the eye, as you can see in this illustration, producing radiating skin folds from lateral angle of eye, which may be a permanent feature in some old people, forming the so-called crow's feet. So that's the reason why I've given you a hint. So in fact, I've given you the answer. You can see a crow, you can see its feet. So obviously the answer has to be crow's feet or crow feet, right? Okay, well done. So this is because of contraction of entire orbicularis oculi muscles. Okay, very good, Manav. Right, good. Now let's discuss some related information. I mean, I'm not going to talk about crow and their feet, even though I love photography. This is something which I secured from Google. So this is not my photo, or the one which I captured with my cam. So you can see two illustrations here, left and right. So what do they represent? Let's review some information. Ectropion, you see T-R-O-P-I-O-N, ectropion, the left illustration. The paralysis of orbicularis oculi results in drooping of lower eyelid, which is called as ectropion, causing spilling of tears on cheek. As you can see in the right illustration, that is epiphora. Ectropion, left illustration, epiphora, right illustration, tears from the cheek, right? I hope it's clear. Ankur, from next time I'm going to take your picture and I'm going to keep you as a model, don't worry. I don't know Ankur, I have no details about her. I'm really glad to know that you are very much interested, Ankur. Okay, fourth question, match the following. So facial muscles. So I think you also had questions from these topics in the recently concluded INSA. So on left side you have the following options: laughing, worry, sadness, anger. On right side you have right column. You have muscles: dilator neris, levator labii superioris, orbicularis oculi, zygomaticus major. So laughing we rarely do. Worry is one of our constantly experienced features thanks to entrance preparation. Sadness, obviously, yes. Worry and sadness go hand in hand, just like bread and jam or bread and butter, isn't it? Anger, maybe. In my case, it's very nil or absent. But I'm sure some of you who are very young, with boiling blood, might be much angrier. So, various actions produced by facial muscles and the respective muscles causing the same. So, do match the following and post your answers. Okay, A2, C3, or whatever the sequence is. So we have various muscles of face, facial muscles producing specific actions or features. Like any emotional response that we elicit, we should thank our facial muscles because we're able to do so because of these facial muscles, isn't it? So try answering. I'm sure you might have gone through these options and you might have already answered. Some of you are still answering. In the meantime, observe these illustrations. So you can see various muscles of face, right? This is an illustration, not actual cadaver image. This is an illustration. And I'll again get back to this illustration. This is a second illustration with specific muscles of face. First, we'll start from this. So various emotional experiences, their presenting features and facial muscles. As you can see, in case of surprise, horror, or fright, transverse wrinkles of forehead, frontalis is a muscle which is responsible for the same. Frowning, vertical wrinkles of forehead or transverse wrinkles across the root of nose. And the muscles which are implicated include procerus and corrugated supercilii. Anger, dilated nares and depressor septi. Laughing, zygomaticus major, more laughing. Sadness, sorrow, grief, levator labius superioris, levator anguli oris, and zygomaticus minor. And then depressor anguli oris. Grinning, risorius. Disdain or doubt. I'm sure this is also one of the emotional responses which you often face during preparation. So, mentalis. Worry, orbicularis oculi. Irony, depressor levi inferioris. We still have so many features. We're just limited to this particular table or illustration. Now, let's get back to this. So, as you can see, we have several options, right? So, laughing, worry, sadness, anger. So, laughing. So, A goes to 4, zygomaticus major, just like how we discussed now. Worry, orbicularis oculi, sadness, levator levi superioris, anger, dilator nares. So in these illustrations, you can find those muscles, right? Facial muscles on to the right. Levator levi superioris, alacrine nasi, procerus, compressor nares. Dilator nares is not evident here. We'll look into that in the next illustration. And then we have levator levi superioris, orbicularis oculi and oris. We are very confident in highlighting or marking them. Levator anguli oris, buccinator mentalis, depressor levi inferioris, depressor anguli oris, platysma, zygomaticus major, masseter, zygomaticus minor, and other muscles. And here you can see a dilator nares. So compressor nares and dilator nares. So right side, you can see the illustration being pointed out towards dilator nares, right? So I think you have already answered this question. So A4, B3, C2, and D1. Okay. So just go through these muscles, and the best way to remember this particular table is to act. Just take a mirror or your front cam, angulate it, and then start giving these expressions. I'm sure you'll never ever forget the muscles which are responsible, provided you should know the muscle attachments. You should know where the muscles are present actually anatomically. So for that, observe these illustrations in your free time and then use this table and use a front cam or mirror and start giving expressions. Please don't record it. For nature's sake, please don't record it. I'm sure you can remember all of them without any doubt. And if you're not able to produce certain emotional responses, please don't worry. Observe some actors or actresses who does excellent job in giving these emotional responses. And if you still have any doubts and if you need expert opinion, we have these serials, Hindi or local language serials, or you can watch some serials. I'll name some for your convenience, like Kyonki Saas Bhi Kavi Bahuti, Kora Kagaj, and so many other daily serials. You can watch them. You will get all the facial expressions which you need. Okay, right. Okay, well done. Now let's move on to the next question. Again, matching. Match the following boundaries of infratemporal fossa. So I'm sure you got several matching questions based on what you mentioned in the recently concluded exam. So match the following boundaries of infratemporal fossa. So anterior, roof, medial, lateral, and you have the following corresponding options. So ramus of mandible, lateral pterygoid plate, infratemporal surface of greater wing of sphenoid, posterior surface of body of maxilla. I'll pause for a few seconds, try answering. I'll go with an illustration and then review some literature, and we'll look into these boundaries again by reviewing that particular illustration, which will be easier for us to remember, isn't it? So, Shivangi, Ankur, Neha, Gargi, they're all laughing, which means you might have seen those serials, right? No kidding. You might have seen those serials. Okay. So try answering this based on visualization technique. Anyways, we'll review the same information with a specific illustration. 4, 3, 2, 1. Okay. Yeah, please do take some time. Okay. I think I've given you adequate time. Now observe this illustration. So infratemporal fossa at a deeper level where the zygomatic arch has been removed for our convenience of viewing. So you can see various boundaries mentioned here. Forget about the theory part. Don't look at those words or phrases. Just observe the illustration. So the one which is in square, that's your infratemporal fossa. And then you can see anteriorly. So posterior surface of maxilla. Isn't that obvious? The velvet or violet color. So anterior boundary is posterior surface of maxilla. Roof, if you observe, superior inferior surface, greater wing of sphenoid, and then medially lateral pterygoid plate of sphenoid, and then posteriorly styloid process and external auditory meatus, and inferiorly superior body of mandible, laterally ramus of mandible and zygomatic arch, which are not actually visible in this particular illustration because they have been removed so that we can view this particular illustration. So just observe this illustration and then we'll move on to the options once again. So anterior boundary as clearly evident in this particular illustration, posterior surface of body of maxilla. The roof is formed by infratemporal surface of greater wing of sphenoid, as mentioned as superior in this particular illustration. So superior or the roof, right? So greater wing of sphenoid, medially lateral pterygoid plate and pyramidal process of palatine bone, which you can make a note of, and then laterally ramus of mandible, zygomatic arch. Okay, so if you can learn from these illustrations, you need not really memorize these options. I usually never memorize these things because it has to be illustrative approach or image-based learning process or methodology, which makes our learning convenient and fun and even more effective. More than that, it's even more effective, isn't it? So now we can go through the options once again. So anteriorly, posterior surface of body of maxilla, roof, infratemporal surface of greater wing of sphenoid, medially, lateral pterygoid plate, laterally, ramus of mandible. Right, so 4, 3, 2, 1, as most of you rightly answered. Fantastic. Now, let's move on to a final image-based or case-based question. You can answer this in the next session, tomorrow's session. You can consider this as your homework. I love giving homeworks. So you can consider this as a homework, do some homework and get back tomorrow. So we'll start tomorrow's quick revision class with this case-based question and then we'll move on to other topics based on subject which we choose, basic subject. So an 18-month-old boy diagnosed with Clausen's syndrome needs to have surgery to treat the prematurely fused cranial bones. The joints and flat bones of fused cranium are classified as which of the following? Option A, sutures. Option B, symphysis. Option C, synchondrosis. Option D, syndesmosis. I'm not going to look into your answers because, as I said, I'm going to again pose the same question tomorrow. So consider this as your homework question. I'm not looking at your answers. Right? Fantastic. So these are some of the topics which I wanted to highlight. So as we move on, we'll deal with more subjects and more topics. And the objective of these sessions, as I mentioned in the beginning of the first quick revision class, is to make sure that we are spreading positivity and maintaining that enthusiasm. So in this process, we'll discuss simple questions, medium range questions, difficult questions, and I'm sure regardless of the complexity of these questions, you'll be participating actively, which is key to learning and to enjoy the process, isn't it? So you have any doubts, you need any further clarifications, you can always get back through mail at proudtobedentist@gmail.com 24/7, and I mean it. Okay? So I really appreciate your enthusiasm and active participation. I'll see you tomorrow at 8 a.m. in our study club. Until then, good night. Love you all. And most importantly, dream big. And as I started with this live session by mentioning about yesterday's 15 days before NEET topic, always keep in mind, especially in these final days, it's not the amount of subject that goes into your mind. Rather, what's far more important, as we have seen in yesterday's live session, is how you enhance your confidence and stay positive in these final days of preparation. Confidence building measures. So which measures are you going to take? Customize them and make sure that you're enhancing your confidence and try staying positive and optimistic. Okay? So wish you all the best. Love you all. I'll see you again tomorrow morning. And also tomorrow evening. So 8 a.m., 8 p.m. 8 a.m. study club discussions in Telegram, 8 p.m. quick revision classes in YouTube. Okay? Chalo, good night. Yeah, you're welcome, guys. Love you all. Love you too.